My name is Jessica Roman. I will be taking your health history today and taking care of you. Please state your name and date of birth.
Alex Mattis, 4795.
And what would you prefer to be
Just
addressed
Alex,
as?
it's fine.
Okay, awesome. My name is Jessica. I'm a UIC Master's Entry student looking to enter family medicine. Do you have any questions before we begin?
I don't think so.
Okay, awesome. And what brings you here today?
Just a yearly physical.
And when was the last time you've been to the doctor's?
About a year or so, maybe a little longer.
And what was the purpose for that visit?
Just another physical checkup.
And was there any abnormal findings from that visit?
Can't say that there was.
Okay. And do you have like a history of any diseases or any medical issues currently?
No.
Any mental issues as
No.
well? Okay. Do you have like any concerns of like your general well-being or any disabilities?
I don't think right now, no.
And then, for some more information about your past history, are you up to date with your immunizations?
Yes, I'm up to date. Can't give you specifics on everything, but I know every time I go in there, they go through the checklist and make sure I'm all good to go.
Okay, and did you receive a flu shot this season?
I did not, no.
Okay. Do you have like any seasonal allergies or food allergies?
I do have seasonal allergies, yes. I'm allergic to like pollen, grass, all the trees and bushes and everything outside, basically.
All right, and then when in contact with these allergens, what are your typical symptoms?
Just a lot of sneezing, stuffiness, just in general, just like congestion, basically.
Any other drug allergies?
Penicillin, yes.
Okay.
And that's like a breakout if I ingest that.
Okay. And have you had any other serious hospitalizations?
No.
Any past surgeries?
No.
Have you been in any accidents or had any major injuries?
No.
Are you currently on any medication?
Just like over the counter for allergies and things like that.
What specific medications?
Flonase and Claritin, just as needed, as directions. Just like one Claritin and then a spray or two of the Flonase.
Okay. Now I just want to ask a little bit of information about like your family history. Do you have, are your grandparents or both sets alive?
No. I have my grandpa on my dad's side passed away, and grandma on my dad's side also passed away. And my grandpa on my mom's side passed away as well.
Okay, and what were the reasons for the passing?
My grandma on my dad's side just died of old age. She was really old. My grandpa died of prostate cancer when he was like 50. And then my other grandpa had died from complications from diabetes, type 2.
Okay, and then your mom's grandma is still alive?
Yes, she's still alive. She's healthy and everything.
Okay. And are both of your parents alive?
Yes, both alive.
Do they have any medical issues?
Yes, my dad recently had prostate cancer, but he had surgery for that, so that's gone. My mom has like asthma and such like that, but she also has the type 2 diabetes that my grandpa had as well.
Okay. And do you have any brothers and sisters?
Yes, I have a brother and I have a sister. Both of them are healthy though. My brother he had asthma when he was younger, but he grew out of that.
Okay. And do you have like any aunts or uncles?
Yes, but they're all healthy.
Okay. And how many brothers does your dad have? Sisters?
I only have one uncle on my dad's side, and then one on my mom's side.
And does anyone, if you're aware of anyone in your family, do they have like any, besides what was noted, allergies, asthma, or high blood pressure?
I don't believe so.
Any heart disease, stroke, diabetes, besides what was noted?
I don't think so, no.
Cancer, thyroid disease, blood disorders?
No.
Obesity, vision or hearing problems?
No, that's just with general age and things like that,
Okay.
but no.
And any genetic or like birth defects?
No.
And any like neurological issues, health,
No.
learning disabilities or mental health?
No, nothing like that.
Okay. And in terms of like your immediate family, who do you live with
I
currently?
live with my parents.
Okay.
It's just us. So both my brother and my sister moved out.
And how would you describe your relationship at home with your
It's
parents?
good. It's healthy. Very supportive of everything.
Okay. And are you currently working?
No, just a student right now.
Okay. And have you ever had any jobs in the past?
No.
So maybe a little bit of a personal question, but when growing up, did you have like adequate resources for like living like your daily life and like access to healthcare?
We lived in a suburban neighborhood. We lived across the street from a grocery store, things like that. We had like healthcare. We had good access to hospitals and things. There were 3 within driving distance of us, so that was always helpful.
Okay. And did you go to like your primary care doctor?
Yeah, regular visits, yearly checkups and things, or when we were sick as needed.
Okay. And you have health insurance?
Yes.
So I know you mentioned you're a student right now. How many years of school have you completed?
I'm going to graduate in this upcoming May, but so pre-kindergarten through my junior year, and I'm about to complete my senior year of college, bachelor's degree.
And what are you studying?
Kinesiology.
And just like a little bit of like your social history. Do you drink alcohol or have you drank alcohol in the past?
Yes.
About how frequently, like each week, would you say you drink alcohol?
It's pretty infrequent. I guess maybe like a 6-pack or 2 spread like throughout a month. Nothing like too serious.
Okay. Do you currently use tobacco?
No.
Have you used tobacco in the past?
No.
Do you drink any caffeinated beverages such as like coffee, soda, or energy drinks?
Yeah, I drink maybe 3 or 4 cups of coffee in the mornings. Wake up a little bit.
So is this daily?
Yeah.
Any other caffeinated beverages?
No, that's pretty much it.
Do you currently use any recreational drugs or use drugs in the past?
No.
And as for sleep, how many hours a night would you say that you get?
Probably 7 to 8 hours on average.
And do you have any sleep disturbances that'll wake you up?
No.
Do you exercise at all?
Yes, I exercise about 5 times a week for 2 or 3 hours or so.
And what other leisure activities do you like, such as watching TV or video games?
Yeah, I like to play video games or hang out with my friends, watch TV for maybe a couple hours a day.
How many hours if you had to make an estimate?
2 or 3.
And now think back the last 24 hours. What did you have to eat?
Well, I had eggs and bacon and toast with a banana in the morning. Then for lunch, I just had a sandwich and a glass or 2 of milk, 2 to be specific. Then spread throughout the day, I had maybe a cup and a half or so of cereal, 2-3 servings of cereal. Then for dinner, I had some lasagna. Then spread throughout the day, I try and drink 6 to 8 cups of water, but sometimes it kind of varies.
Okay. And just in general, throughout the week, how many times do you think you go out to eat at a restaurant or fast food?
Not too much, maybe 2-3 meals a week.
Okay. And do you have any special dietary restrictions or practices?
No.
And then this is another personal topic, but do you feel like you have a lot of stress in your life?
Not particularly, just the average college student, exams and things.
So would you say that the stress is brought on from homework and schoolwork?
Yeah, it's just a combination of different lifestyle things going on.
Okay. And how do you generally cope with those stressors?
I like to lift or just listen to music or things like that.
Do you ever feel like you have? Do you ever feel like you can't cope with the stress?
No, I think it's pretty manageable most of the time.
And have you ever witnessed any traumatic event, any violent exposures, any gun violence or any act of crime?
No.
Has anyone in your family?
I don't believe so.
Have you established any, have you ever been a part of any abuse or
No.
anyone in your family?
No.
So for like safety, like when you drive or like when you're in a car, do you wear like a seatbelt?
Yeah, all the time in the car and things like that. It's
And
just second nature.
okay. And when you like ride a bike or snowboard or any type of activity like that, do you wear a helmet?
No. Probably should, but
At home, do you have like any presence of like a carbon monoxide detector, a fire a detector,
yes, all that kind of stuff.
any like guns or weapons at home?
No.
So like currently or in the past, like, have you been exposed to like any like toxins, like in your home environment, at school, in a community?
I don't think so.
Okay. Any like secondhand smoke?
No.
And do you have like for your water source at home? Do you have like adequate?
Yeah, we have like Hinkley and Springs bottle type thing that we drink from. Just like a giant cooler.
And then, do you have like a specific religion affiliation?
Yes, I'm Lutheran.
And do you have like any like restrictions to healthcare like related to your faith?
No.
So now I just want to ask like just like some general questions like about like your overall like health of your body. Like currently, are you experiencing like any fever, chills, like fatigue?
No.
Any like night sweats or like body aches?
No.
And do you feel like you have any significant weight loss?
No.
Are you currently experiencing like any pain?
No.
So on a scale from 1 to 10, like from 1 to 10, would you say you have anything?
Nah, it's probably 1.
Have you noticed any abnormalities like with your skin, like any moles or lesions that popped up?
No.
Any changes like in your nails, like fingernails or toes?
I don't think so, no.
And when you're outside, do you use like sunscreen ever?
Yeah.
With your hair, have you noticed like any abnormal like distributions or hair thinning?
No.
With your scalp, have you experienced like any itchiness or dryness?
No.
For your eyes, do you wear any glasses or contacts?
Yes, I wear contacts and then glasses as needed, but it's mostly just contacts.
And when was the last time you went to the eye doctor?
Like within a year to renew prescriptions and things like that.
Do you have like any other eye issues?
No.
Have you experienced any like hearing loss or any changes in hearing?
No.
Do you notice like any pain or tenderness around your ears?
No.
Do you have any like do you get frequent colds at all?
No, just normal with change of seasons and things like that.
Do you have like any like a stuffy nose right now? Any sinus infections or anything?
No.
Any pain?
No, I don't think so.
And for your teeth, when was the last time you went to the dentist?
6 to 7 months ago. I usually go every like twice a year or so.
And do you brush frequently?
Yes.
How many
Usually
times?
brush twice a day.
Do you floss?
No, unfortunately not.
And do you have like any other dental issues? Any missing teeth?
I had braces growing up, but like no missing teeth or anything like that. Now they're pretty straight and normal.
Okay. And for your neck, do you notice like any stiffness or any pain?
No, it's pretty normal.
Okay. And have you noticed any like lumps or tenderness at all?
No.
And for your breasts, have you noticed like any tenderness or any lumps?
No.
Have you had any nipple discharge?
No.
As for your chest, do you have like any like frequent coughs or mucus that comes up?
No.
Any shortness of breath or wheezing?
No.
Have you ever had asthma as a kid or a history of that?
No.
Have you experienced any chest pain?
Can't say that I have, no.
No history of like hypertension or heart murmurs or any abnormalities with the heart? And as for, ask a little bit about your gastrointestinal tract. I'm sorry if these questions are a little uncomfortable, but when was the last time you had your bowel movement?
Earlier this morning.
And how many times a day do you normally have a bowel movement?
Probably like 2 or 3.
Do you have like any diarrhea or constipation?
No.
Do you have any like nausea or vomiting recently? No. Any abdominal pains?
No.
Food intolerance?
No allergies or anything like that.
Do you have like any issues like going pee?
No.
Any like frequency or are you not able to hold your bladder?
No, I think everything's pretty normal.
No pain?
No.
Any discharge?
No.
So I'm gonna ask a little bit of personal questions just about like your sexual history. Do you have like any desire to have kids in the future?
Yeah.
Do you have like any known infertility issues?
Not that I know of, no.
And have you ever had a prostate exam?
No, not yet.
Are you currently sexually active?
Yes.
With how many partners?
Just one.
Okay. With your sexual activity, do you which genders do you normally?
Female.
Female. And how many partners have you had?
In the past?
Yes.
5.
Do you use any contraceptives when sexually active?
Yes, my girlfriend uses birth control.
Any others?
No.
Okay. And with your muscles, have you noticed like any weakness or stiffening with your
No.
muscles? Any limited like movements or range of motion?
No.
Any joints or back issues?
No.
Okay. Any issues like walking or running?
No.
And as for like neurological issues, have you had like a history of any like head injury or
No.
loss of consciousness?
No.
Loss of coordination, dizziness, numbness?
No.
Okay. Any like tremors, like frequent headaches?
No.
Any like impaired cognitive functioning, like impaired memory?
No.
Okay. And is there any history of anemia?
No.
Or any blood disorders?
No.
Okay. Any history of like blood transfusions?
No.
Thyroid issues?
No.
Okay. Any unusual sensitivity to hot and cold?
I don't think so, no.
Okay. And as for like mental status, I know you mentioned previously that you don't have any past medical issues, but do you experience any like anxiety or panic attacks or depression in the past couple days?
No.
Any suicidal attempts or ideations?
No.
Any eating disorders or any
No.
other? Okay. Other than that, I think I have everything I need. Do you have any other questions or any concerns about your health or anything else that would be important for us to know?
I don't think so.
Okay.
That's pretty much everything.
Okay. Awesome. Well, thank you.
Yes, of course.